Okay, members, any questions?
Yeah.
Senator San Buenaventura.
Department of Health. Thank you. So I have a number of questions. So I'm looking at the bill.
Yes.
And basically, last time I think I talked to you folks, do you folks have any plans of opening up the dispensary licenses and issuing more licenses?
We're always prepared for that possibility, but we've not reached a point where we are having patients identifying to us that there's a need.
So right now, we've opened up these 8 dispensaries, and right now you have no plans on seeking more dispensary licenses.
Not at the current time. We do constantly assess the patient numbers, the geographic locations of where those patients are, as compared to where the retail locations are. We are looking at the production numbers.
So the answer is no. Okay,
Yeah,
I just want
I'm
to,
sorry. Okay,
thank you.
yes, I was just trying.
because I have more questions.
Okay, yeah.
So when the bill asks to actually remove the annual fee and the application fee, basically then it just benefits the existing dispensaries, right? Because you guys have no plans immediately to ask for more dispensary licenses.
I think that the intent is really to just allow us to revise and set those fees by administrative rule instead of having a flat
50
fee
grams
set in statute. And this is kind of a trend that other states are moving towards. They're looking at the actual capacity of a dispensary licensee, how much cultivation, how many plants they're harvesting, how many stores they manage, and all of that, and setting the fees based on that information. And this allows.
So you want it to be more dynamic, but
correct.
Right, but the reality is, if you have no plans, and you haven't, because every time I've asked whether or not it's Keith Ridley, whether or not you folks are going to ask for more dispensary licenses, the answer was always no. So, but immediately, if we remove those amounts, the immediate benefit are to only the 8 existing dispensaries, right? So we won't be collecting the 50 grand for the existing ones, unless you folks already have a plan in place on how you're going to charge the renewal fees.
No, and I'm sorry but that was not the intent. The intent was not to remove it completely, but replace it with allowing the department, giving the department authority to set those fees in administrative rules versus having them set in statute. So my apologies if our testimony is incorrect on that.
Okay, well, no, it's not. I'm just questioning.
Okay.
Okay, the other thing is, my concern, and it's always been my concern, was that if we're going to increase the retail, which is what this bill wants, the existing dispensaries, from what I've seen, the retail spaces are clustered around population centers. So we have like multiple retail places like in Hilo and in Kona and in Metro Honolulu. So if we increase the retail space, it doesn't actually serve the underserved areas.
Correct.
Because they're going to choose where they're going to profit, which are in metros. So is there any, if we pass this bill, is there one, you folks have testified that you folks don't have enough money, but you don't have any plan in place on how you guys are going to get the monies beyond the 50,000 that you folks have removed from this bill. And 2, how do we actually serve the underserved areas when you don't increase dispensary licenses or require them? If we're going to have the retail spaces to go to Molokai, to go to Puna, to go to Ka'u, where they are not serving them.
Correct. And so this is one of the reasons why what we are asking is to allow the department the authority to make the determination on where additional retail locations should be authorized and allowed. And it should be based on patient need. It should be based on underserved communities. And the way that the statute is written now, the department does not have any control over that, other than that there has to be at least 500 registered patients in a county, with very little control over dictating where a dispensary can or cannot locate its retail locations. And we agree that the two Big Island dispensaries chose to locate their retail stores in a couple of places within walking distance of each other. And it's our opinion, that's what resulted in large areas of underserved patients on the Big
And
Island.
by passing this, it doesn't even guarantee that they are going to go to the underserved areas because it doesn't have any geographical requirements, right?
We
So,
understand.
and my last question is, if you're going to remove the 50 grand annually, but you still testify that there's need for monies, do you folks have a plan to be self-sufficient?
No, currently, this year, the program was moved from special funds to general funds. So we are funded by general funds. However, prior to that, we were completely special funded off of dispensary licensing fees as well as patient registration fees. And, our 6-year projection showed that we could be self-sustaining off of those fees.
That was my memory when we first passed these bills.
And that, I believe that if we are able to properly adjust fees, as I suggest, based on the system needs, based on the program's need, we can be self-sustaining.
Okay, I have no further questions. Thank you.
You're welcome.
Members, any other questions? Hold on. Senator DeCoite.
So thank you. So now I get a question. So how do you still factor in that now you can be self-sustaining when you're removing the fees?
Mhm.
How do you expect to recoup that with the existing dispensaries?
Yeah, as I mentioned, the intent was not to remove those fees. The intent was really was to allow us to set the fees by administrative rules.
So you guys got an amount in mind? Is it the existing that you guys are going to be putting back into the existing fees, or are you going to ask for something higher?
It would depend on the particular licensee, right? The number of facilities they have, the capacity, the industry itself. We have 8 licensees. Every single licensee's capacity is extremely different. Some of them are very small, limited operations. Some of them are very large operations that, based on their production, could literally be provide to a third or more of the entire state's industry. So it's because it's so dynamic and differing, it just really doesn't make sense to have a set flat fee that each licensee is charged. And that's what we would like to do, is to be able to
Make an adjustment.
make adjustments, make
Okay.
appropriate adjustments.
So I want to
And
go.
we have looked at.
Okay, so let me go to when you talked about the underserved areas. So right now, the islands, which I represent, Molokai and Lanai, does not have a dispensary. Will they continue to be able to self-grow to take care of those needs of those patients?
I will have to look. I do know there were specific statutory prohibitions for location of certain dispensaries geographic, but if they're not, and the other thing was the limitation on number of registered patients, but I believe that it was just county. I don't think it was based on island. So I would have to go back and take a look at that. I'm sorry.
Because I think you guys have 500 registered patients in a county,
In
which
a
I know you guys
county.
are way over.
Right.
Okay, thank you, Chair.
Chair, I have a question.
Senator Moriwaki.
Yes, so do you have standards that you would apply, that you've developed over the years, so that if you go to rulemaking, you have standards already in place? Or are you going to start now to try to develop the standards?
We've already started looking into it. I don't have anything that's been, I don't have any suggestions drafted out right now, but Hawaii is a member of the National Cannabis Regulators Association. It's a national organization of states regulators, and I'm actually on the executive board. And so I have already been engaged in almost weekly discussions with other states, and those are the types of discussions that we have. How do you make the decision about how much plant capacity a production center can manage, based on square footage, based on their personnel, based on the size of the facility, based on patient need? How do you make a decision about where to locate retail? You take into account geographic distance, commute time, and all of, access to public transport. So we've been engaged ongoing in those types of discussions for a couple of years now. So we have a lot of information. It just needs to be synthesized and put together into a plan.
So one more question. You say you need staff for 155,003 FTE for this year and 290,000 ongoing. And if you don't have a special fund and you're not collecting fees, is this going to be an ongoing cost for the state?
Yes, it will be if it's not special funded.
Because there's no appropriation in this bill either.
Correct. Understood. And that's our primary concern is.
It takes some 2 years to do an administrative rules.
Members, any other questions? No. Okay, I have a question. So last year, we gave you the authority to set fees by administrative rule, correct?
Those are for patient registration costs, and yes, those are being worked on. We have the changes to the administrative rules are in draft form. And
So you're in the process of setting fees, at least on one part of the framework, in
Correct.
order to account for these capacity issues, which you noted in your testimony on similar legislation last year. And then this bill essentially would authorize you to set fees as you determine are necessary on the licensees themselves to try and cover costs.
Yeah,
Okay.
it's essentially doing the same thing, but on the other side of the house.
Okay, so, I want to pivot to a question about your testimony. You note that the production facility, the sections that allow increase in production facilities are not justified based off of your assessment that all of the licensee capacity has not been fulfilled. So one of the testifiers suggests that notes a lack of appreciation for the difficulties of doing business in Hawaii.
I'm sorry, and
Would you like to respond to that?
we understand it's been a significant challenge for the licensees to stand up their facilities.
So aside from that assessment of overall capacity among all of the licensees, have you done a review of balance sheets of these businesses to determine whether they've reached full capacity, or is there some other assessment you've used just besides the rudimentary math?
Basically, what we've looked at is the volume of plant production, the volume of sales. So in other words, the amount of that production that's going into products, to cannabis and manufactured products, and resulting into sale, because that's also an important
Okay,
thing to take.
so
into
do you have an assessment of how many caregiver co-ops exist in the state?
I do not.
Do you have an
would to-
assessment of their production capacity
I do not.
or an assessment of their total distribution? So how can you make a reasonable assessment of supply and demand when you have no data on the caregiver co-op framework and you haven't done a meaningful assessment of the business practices of the licensees?
Understood. The cooperative, the caregiver cooperative system is completely unregulated. It's not under.
So you're not even able to say at this point whether there could be illegal diversion from the co-ops to non-certified patients.
No.
So wouldn't that be a larger liability than potential diversion from the licensees that are under your regulation?
It is a concern, and I think it's the reason why in past years the department has tried to move up.
How
the
many
sunset
licensee
date.
violations have you issued in the last 2 years?
In the last 2 years, off the top of my head, it's under 100 each year. And the majority of them are primarily for, the majority of them actually are for security violations.
What type of violations?
Uh, for not maintaining security, perimeter security and improper tracking of product throughout the system. But in all of the cases, those discrepancies have been reconciled. We don't have anything that indicates that there's been wholesale diversion from the system. In others, we haven't found anything that in our assessment, and we do work closely with the Narcotics Enforcement Division, that amounts to a concern that there is diversion occurring from the license system.
So your assessment is that the regulated framework, the licensees as they currently exist, are by and large operating as was intended when we originally did the dispensary bill, which was to not run so egregiously afoul of regulation that we trigger some sort of federal
Correct.
oversight, right? Okay, hello. We are reconvening this Tuesday, March 15th, 9:30 a.m. joint committee hearing between the Senate Health Committee and the Senate Consumer Protection Committee. When we lost the feed, we had received testimony and we're taking member questions to testifiers on HB 2260 HD1, which makes amendments to the cannabis regulation framework in the Department of Health. I'd like to acknowledge Senator Revere for a question.
Thanks for your patience. So the cooperatives are providing a segment of the market, which is different from the dispensaries. And I'm just wondering how we should look at that. And is there a regulation for the cooperatives, or how is that handled differently?
There is not, and that is a significant concern. And so basically the only control that the health department has right now, because the cooperatives are an outgrowth of patient cultivation, right? They're allowed to assign a caregiver to cultivate for them. But there's currently no limit to the grow site limitation. So that's essentially what's happening is patients are registering the same grow site for their home grow. And that's what's resulted in these cooperatives.
How many cooperatives are there approximately?
We don't know.
I mean, is it like 5 or is it like 1,000? Is it two people makes a cooperative, or what's the definition of a cooperative?
It's just multiple sites of growth. And so that's the reason why in past session, we had suggested that there be limitations on the number of grow sites that can be registered to a physical location. And then also limitations on the home grow system.
Do you use a similar for chain of command, or to make sure that there's no leak or malfeasance going on there? Are you using the same sort of oversight with the cooperatives?
As I mentioned before, we don't have any regulatory authority over that. We do have authority to, patients are required to tag their home grow plants.
Mhm.
And so if we receive a complaint about, a patient who may have excessive numbers of plants at their residence, they're allowed to grow 10 per patient. We will do an on-site inspection and verification that the plants are properly tagged and associated with a currently registered patient. But beyond that, we do not have much authority. It really becomes a law enforcement.
Do we know how many people are maybe self-growing, home growing, or maybe in a cooperative, and how many customers of dispensaries? Do we have a
We have a
Uh,
rough number. I don't have those figures with me right now, but roughly about 60% of the patient population have a registered cultivation site. So in other words, at least 60% of patients express an intent to home grow when they register for their 329 cards.
But we don't know how many of them are also utilizing dispensaries, or we don't know the market breakout.
We do. We do show that between 35 to 40% of patients access a dispensary on a monthly basis, because we do have the registration numbers, patient registration numbers for patients who make purchases at dispensaries. So we have the total volume of patient purchases, as well as the exact individual numbers of patients that represents. And it's about between 35 to 40% of patients, of registered patients that access the dispensary. So it kind of matches that 60% of the patients
So do you think they're
express-
exclusive 60 and 35%? You think they're different populace, or there must be an overlay?
there is an overlap.
Yeah.
There are some patients who register to home grow as well as access the dispensary.
Okay, thank you. Thank you, Chair. Just want to.
Senator Baker.
Thank you. One of the things that I'm wondering is, because there are other places that have had cannabis laws on their books longer than we have.
Mhm.
Have you been in touch with any of the ones in Colorado, any of the other states that might have established best practices to see if there's either amendments that need to be made to our statute, or if just administratively you can make some adjustments to make sure that people have access, they're getting what the medication that they need, and if there's anything that the legislature might need to do to amend the statute to enable some of those best practices?
Those are some of the things that we have been, as I mentioned, the Regulators Association, we do meet, we meet as an executive board twice a month, and then as the membership meets twice a month as well. So there's a lot of ongoing discussion and on that. We've discussed control of home grow and cooperatives, and how other states are handling that situation as well. Best practices as far as manufacturing requirements. We just updated our administrative rules, focusing primarily on manufacturing practices and laboratory testing, to update those, because those rules haven't been updated since 2015.
But you haven't necessarily shared that information either with the legislature or maybe even with the public, correct?
No, we've not really had an opportunity to do so. It is something that we would like to do. It's a matter of competing priorities for activities that we're able to engage in.
I appreciate that, but if you don't have the legislature in the loop, if there's something comes up that you need, you're probably not going to get it. So
Understood.
you might want to consider being a little bit more proactive with the committees to give them the information and listen to what questions they have and what other things are coming out of the community that either need to be addressed at the legislative level, or ramp up your admin rules. And in terms of your admin rules, have you asked to have a briefing with the legislature to explain some of the things that are going into the rules that might address some of the issues that have come up today?
No, we have not. And I do apologize. As I mentioned, I was out on leave, and the rules happened to be signed and became effective while I was out on leave. So we'd be happy to do that.
You might
As
want to
well.
consider that.
The program manager position for the Office of Medical Cannabis Control and Regulation actually was finally just filled last week, Monday, even though the legislature authorized that program back in 2019. It's taken us that long to stand up
So
the administration.
who's handling that program now?
I was appointed as the program manager, so I started in that role last week, Monday.
So how many hats are you wearing?
Currently, that one as well as continuing to supervise a dispensary licensing section until that position can be recruited and filled. I mean, that's been the limitation. The whole dispensary system for the past 2 years has been 3 people, myself and 2 inspectors.
Okay, thank you, Chair.
Members, any other questions? I have 2 just to follow up. One is, how many funded positions are there in the office?
Currently funded positions, there are, I know dispensary inside out, whole program 19, I believe, funded.
And then how many are filled?
Of the 19 positions, we have 5 plus. Oh my gosh, terrible.
Or how many are vacant? Do you know?
Yeah, so dispensary has 2 vacancies, registry has 2 vacancies. So we should have 15 filled positions and 4 vacant currently.
Okay, so you have authority to issue fees to patients. This bill proposes to establish discretion for you to set fees for dispensaries, and you have 4 vacant positions. How many, do you know the total number? Going back to Senator Rivera's question, do we have a ballpark total number of certified cannabis patients in the state?
I think I think the last month's count was, there are roughly about 34,000 currently certified patients. I can provide the exact figure, as well as the caregiver counts.
So it's fair to say that there are at least 15,000 patients that are utilizing co-ops, probably as high as 20, maybe even 25.
Possibly.
That are utilizing non-regulated co-ops. Is there an exposure to the state for liability with any of those patients who utilize co-ops and get sick?
That's a good question, and that's something that I don't know. I
Okay.
don't know. But it is, I mean, the intent of standing up the dispensary system was to ensure access to regulated, tested product. And, that's not necessarily happening with co-ops.
Okay, unless there are any other questions, Senator Bacon.
Your question made me think, is there a need for something in the statute to require regulation of co-ops?
That's a possibility. I believe one state, a couple of states, Washington State, I believe does regulate their cooperatives. They require them to register, and there are requirements that they must comply with.
If the legislature chose to go down that road in this bill or something else, would you be willing and able to help put some language together that would at least require minimum regulation with the department, abiding by standards, that sort of thing?
Yes, I'd be happy to look at, and talk with other states that do such, do include them and work on that.
Okay, thank you, Chair.
Okay, if there are no other questions, we're going to recess for decision making. Recess.